This is going to be a myofascial release option for the pec, which is a common area that gets very tight and pulls the shoulder blade in this up and forward direction. So we have a couple ball options. Obviously, the bigger and harder the ball, the more uncomfortable or the more pressure you're going to get. So you may want to start with something smaller, tennis ball, lacrosse ball, and if that doesn't do the trick, something bigger like a softball that's hard is going to do pretty well. So for someone who can't lie down, just standing between you and a wall, if I take this tennis ball, I'm going to place it. So my pec, right, as I come over here to my shoulder, if I come down like this meaty portion right here, and then coming all the way up and across is going to be my pec coming up from this direction to attach to the front of my shoulder. So this is typically an area that's very tender and sensitive, and then I can even start coming a little bit closer in towards my center to hit this area as well. So with any technique, you're trying to find points that are sensitive. So using this tennis ball, I'll put it between myself and the wall at any of those spots, right? And I'll try and find a spot that's a little tender, and I'm going to start off just lightly leaning into it and maybe doing just a little shift side to side. So I don't want a ton of motion or this ball's really slipping around. And I can hit some different points. Usually when I find a point that's sensitive or uncomfortable, I want to keep that sustained pressure with just a small rocking motion for about 30 seconds to a minute. And then here, I can start to take myself into more of a pec stretch by bringing my arm up to the side, making sure that I'm not tensing in my neck, and I can do a little bit of a turn away. Not a big motion, just a little bit of a rocking side to side across those fibers of the pec. I really don't want to take my arm much above the level of my shoulders. This is about as high as I would go. But the higher that arm is, the more you're going to feel that pressure into the tissue, because now it's in a little bit more of a lengthened position. I can do the same thing lying down, which is going to be more pressure because now my body weight is going to be pressing down on this ball. So if I lie down on the floor, same thing, I'm going to put this ball anywhere in through that front of the shoulder, not on the shoulder, but in more towards my chest where that pec's coming across. And like we said, even a little bit more in towards my sternum, right? So I'm going to lay down. I'm going to place the ball at any one of these areas that are a little bit sensitive. And I'm going to start off with my arm at my side. And now I have that ball pressing into the front of my shoulder. And I'm just going to very lightly turn to look away from my arm and then bring myself back down towards the floor. So if anything, I'm kind of lifting my opposite shoulder and chest and looking away, which is driving this side down into that ball and then coming back out of it, which eases some of the pressure. In a similar manner, the higher this arm comes up, makes it more sensitive because it puts it in more of a stretch. So as I look away, I'm kind of pressing my chest down into that ball, and as I come back down, that will alleviate pressure. Not forcing it. This isn't something that's supposed to be super uncomfortable, just a light movement in and out of that pressure. If I want, I can gradually work my arm up higher, and it's going to be a little bit more sensitive. Another thing that's worth noting is that your pec is very close to your armpit, which is where a lot of nerves come out. So I don't want to get this ball into my armpit. I want to make sure it stays on that meaty portion in the front of the shoulder. And if this is too sensitive, you may even get some tingling in your hand, which is normal as long as it goes away. You can come a little bit more towards the center, which will be less sensitive.